is Caitlin Brumley, and I'm an occupational therapy student. Today, I'm going to be doing your intervention. So first, can I get your name and your date of birth?
Damon Day, February 22nd, 1979.
Okay, Damon. First, we're going to take your vitals. So I'm going to get your blood pressure, your heart rate, respiratory rate, and your oxygen levels. Okay. Before I do that, I'm going to clean off all of this equipment for you. How are you feeling today?
A little stiff.
Yeah, some stiffness.
Yeah.
You're feeling good? Pretty good today?
Yep.
Alright, we're going to be doing some exercises later today, so hopefully we'll work down some of that sickness. Work on that. Okay, so can I get your pointer finger? Just relax that on your lap. And then can you turn your left wrist over and get your heart rate? Heart rate was 72, and this heart rate matches 72, and our oxygen is 78. And you have 14 breaths per minute, which is normal, in the normal range. Normal is 12 to 20 breaths per minute, so we have nothing to worry about there. And then heart rate was good. It was between 60 and 100. It was 72, so we have nothing to worry about for your heart rate. And then your oxygen saturation was 98, so that was good. We don't want anything below 95. So now I'm going to take your blood pressure. Does your arm feel comfortable right there? Or
Yeah.
would you want to lift it with a pillow? Feel free to. You hold this for me? Okay, go ahead and start, okay? Okay, 118 over 120, or sorry, 118 over 80. And normal is 120 over 80, so your blood pressure is good. Okay, so now that I've taken all of your vitals, we're going to go ahead and get started with the treatment. Do you have any questions for me?
Nope.
Okay. All right, Damon, I'm going to ask you some questions just to get to know you a little bit better, to see what's going on, what concerns you have. So why don't we just start by saying, well, I know that you've had MS for 4 years. That's correct?
Yes.
Okay. And I know you've been having therapy with an occupational therapist. Is that correct too?
Yes.
Okay. Can you tell me about what your concerns are, what you maybe worked on with your OT that you had previously, what your deficits are, what you're having trouble doing.
I'd say I'm having the most trouble with like balance and the stiffness. Like I said earlier today, I'm feeling pretty stiff. So yeah, that bad balance, which has caused me to have a lot more falls frequently. Yeah, I've been falling a lot more than usual. I also feel like my flexibility hasn't been the best either. I feel like that's gotten worse. So like even lifting my arms up, I feel like I can't lift them up as high as I used to. Bending over is difficult. Walking long distances, picking up my feet, dressing. I have a lot of trouble with dressing.
Okay. So do we have trouble like with our endurance, like finishing activities? Like, are you out of breath? Do you feel tired?
Yeah, I get tired really easily, and if my wife doesn't help me get dressed, then I usually feel the effects of that for the day after, especially with like my lower body dressing and putting on my socks and shoes. I can put on my shirt and hoodies and all of that pretty easily. It just takes a lot more effort to put on pants and socks and stuff like that. So
Okay. That may be because of our decreased range of motion and stiffness that we're feeling. We may not be able to get down there. And also our endurance. How's your walking? Are you able to walk any long distances? Can you walk in your house pretty well?
I can walk in my house pretty well. I've noticed that my steps have been a lot smaller as the year has gone on, especially from whenever I was first diagnosed. I like I said, I have trouble picking up my feet, small steps. I can't really walk long distances. I get really tired. So.
Okay. Do you have a walker or a cane?
I do have a walker, but
just a standard 2 wheels?
Yeah.
Do you use it?
Yes.
Okay.
I mean, I don't like using it, but I use it.
And we're having trouble with falls too. Okay. Let's see. What activities are you having difficulty with specifically? Is it just lower body dressing and walking to go do things in your house?
Yeah, that and even getting out of bed in the morning takes a lot of energy. And like I said, dressing, toileting sometimes as well.
Okay. Do you know what type of MS that you have?
They told me, but I don't really remember.
Okay. We should address that today. And what do you enjoy doing?
I'm a pretty simple guy. As much as I would love to go out, I have always been an introvert for the most part, so I like to stay in, read, watch TV, love hanging out with my wife and my kids and our family. So
What do you like to do with your family?
My biggest thing is in the mornings I will make breakfast for my kids before they go to school, and that's just my favorite way to spend time with them, especially in the morning when I have the most energy.
Okay. Do you have any trouble getting breakfast ready for your kids?
Not
Still tired?
Yeah, not too much. I just get that low endurance. So
Okay. And you like reading for enjoyment?
yes.
So how do you feel like your life has changed since you've been diagnosed with MS?
I mean, I wouldn't say it's changed a ton. I mean, back when I was in college, I used to go out a lot, but ever since I met my wife, she's my person, and I just like to spend time with her mostly. I mean, I know my life has changed since I've been diagnosed as well, but I also believe that I can do anything I set my mind to, even though it's going to be hard.
Okay. Well, is there anything else that you'd like to tell me? Any other concerns that you're having before we start?
I don't think so.
Okay. Well, now that I have all of this information, we can go ahead and get started with some assessments.
Okay.
So one of the assessments that I chose to do for you is the Berg Balance Scale. Have you done this before or heard about it?
I don't think so.
No, well, it's basically kind of what it sounds like. It's balance. So it's going to assess how well that you can balance in different positions without support. Okay? So it's typically done to assess if someone is a fall risk, to see like what if that is a concern, if they may fall. Knowing that you have had falls recently and that you have trouble with balance and you're weak, we already know that you are a fall risk, but I want to do this assessment so that I can observe it for myself and that I can look for other underlying deficits or weaknesses through this assessment. Does that make sense?
Yep.
Okay. So I'll just go ahead and tell you that this assessment has been studied and done on MS patients, and it is very reliable in detecting falls, so it's a good source to assess patients because it is proven to be effective in detecting that fall risk in patients with MS.
Okay.
One study that has been done concluded that it can identify patients who are at risk for falling. So it is a good assessment, and that's one of the reasons why I chose it for you today. So before we do the assessment, I'm going to go ahead and go over it with you just briefly so you can kind of know what to expect. So there's 14 different test items, so there's 14 different positions that I'm going to have you stand in. And this is a standardized assessment, so that means that there's a specific script that I have to tell you, and there are specific boundaries that I cannot cross. And one of those boundaries is we cannot use an assistive device. So I know you use your walker to walk around throughout your house and you use it for that balance,
yes.
But for the purpose of this assessment, to keep it standardized and to keep it reliable and valid, we're not going to be able to use your walker.
Okay.
I will have a gait belt on you, and I will be there watching you right next to you to make sure that you're okay. I'll have a chair behind you and your walker in front of you in case you need it. So we don't have any safety concerns to worry about there. So I'll basically have you do these positions. If you're able to withstand them without support, just you, yourself, and your balance, then you're going to score 4, which is the highest. And then it'll go down 3, 2, 1, 0, which is the lowest. So there's different variations within there, but 4 is the highest, 0 is the lowest.
Okay.
Once I finish, I'll tally up all of your scores, and then I will come back and share the results with you, and we'll go over that and some recommendations that I will have.
Okay.
So that is the assessment. So you know kind of what to expect. Do you have any questions about that?
Nope.
Okay, well, let's get started. So the next assessment that I'm going to do with you is called the Functional Assessment of Multiple Sclerosis, or MS. And basically what this is it's a questionnaire that you're going to fill out yourself. So you'll just fill it out, you'll read the questions and circle either 1 through 4 or 0 through 4. It's pretty simple. I will explain it to you once we get there. But just to tell you a little bit about it and its validity, there are studies done with this assessment on patients with MS, and it's proven to be a valid assessment to measure your overall quality of life, how happy you are doing the activities that you can do, or how happy you are unable to do those activities.
Okay.
And it's also proven to distinguish various forms of the disease of MS. So those are 2 of the reasons why I want to do this with you, just to see what your concerns are personally with your condition and the effects of it in your life, and just to see like what other forms of the disease maybe we could identify through this assessment.
Okay.
So there's 7 different categories. As you can see, it's 0 through 4, 0 being not at all, 4 being very much.
So I'll just fill this out for how accurate it is for me?
Yes, for
Okay.
you, how accurate you feel doing these things. And you can read them to yourself if you have trouble or difficulty understanding them. I can read it to you or help explain it a little bit more. And then this is my scoring sheet.
Okay.
So then I'll tally up all of them, all of the scores at the end, and I will come back and I'll give you the results and my recommendations based on the results from this assessment.
Sounds pretty easy.
Okay, do you have any questions before we get started?
Nope, I'm ready to fill it out.
Okay. Okay, Mr. Damon, so now what we're going to do is we're going to do the Berg Balance Scale Assessment. So everything that we talked about earlier, that whole assessment that we went over briefly, that's what we're about to do. So like I said, there's 14 items, so I'm going to have you do 14 different positions with your body just to see how you are with your balance, to see if you are a fall risk, and to just observe any other underlying deficits or concerns that I might have for you. Do you have any questions?
No.
Okay, so I'm going to put this gate belt on you just in case if you start to fall that I can catch you. It's just going to go around your waist. And then I also have my phone to keep time for the stopwatch. And yeah, that's all. So I'm going to go ahead and put this on you. Can you point to your belly button? You don't have anything there, piercings, any kind of tube or anything? No. Can you point to that again? Try to get it tight because when you stand up, you'll lose it. Is that too tight? No, it's good. Alright, so I'm going to give you some instructions, and what I want you to do is just follow those instructions. If you have any questions, let me know, and I'm going to be keeping time on my stopwatch. Okay? So first, I want you to stand up. Try not to use your hand for support. Okay. Okay, next, please stand for 2 minutes without holding on. Okay, moving on to the next item. Please stand up, and then I'll have you sit down. So go ahead and stand up. Okay, please sit down. Okay, next I want you to transfer one way to this seat with armrests. Yeah, go ahead and bring your legs up to this chair. And reach around and grab the armrests and sit down. Okay, good. Now I want you to transfer back to this chair without armrests, okay? Use your arms, lift up, turn to your right, back up to where your knees hit the back of that chair, and you reach for the, there you go. Okay, so now I want you to close your eyes and stand still for 10 seconds. I'm going to set a timer on my phone and I'm going to put it in my pocket. Once I put it in my pocket, then you can start, okay? Right, you okay? Yeah. Okay, let's go ahead and sit down in this chair. Okay, Damon, next we're going to have you stand up and I'm going to have you place your feet together and stand without holding on. Okay.
I think I'll lose my balance if I try that.
Okay, I'll hold on to you while you put your feet together. All right?
All right.
I have someone timing behind the camera too. Let's go ahead and sit down. Okay. All right, Damon, next I'm going to have you lift your arm to 90 degrees, stretch out your fingers, and reach forward as far as you can. Okay, so now you stand up. Reach your arm out to where your fingers are at that 0 centimeters, and then reach forward as far as you can. All right? That's the next one. Okay, next, you're going to pick up the shoe, which is placed in front of your feet.
I think I'm losing my balance.
Okay, let's go ahead and sit back down. All right, next I want you to turn directly behind you over toward your right shoulder and repeat to the left, standing. Turn completely around in a full circle, pause, then turn a full circle in the other direction.
I think I need some help.
All right. Grab onto you, and step with your left foot, and step with your right foot. Turn your left foot, bring your right foot around, turn your left foot, bring your right foot around, left foot, bring your right foot around, left foot, and then bring your right foot to the front. All right, let's go to the right side. Right foot, bring your left foot around, right foot turn, bring your left foot to the back, right foot turn, bring your left foot to the back, right foot turn, bring your left foot to the front. Okay, good. All right, now I want you to place each foot alternately on the step. Continue until each foot has touched the step 4 times. Okay.
I think I'm falling.
Okay, let's go ahead and get back in this chair. Take a step back. And reach for the chair behind you. Good. All right, Damon. Next, I'm going to have you stand up. Place one foot directly in front of the other. If you feel that you cannot place your foot directly in front, try to step far enough ahead that the heel of your forward foot is ahead of the toes of the other foot. So you're going to try to do this. If you can't, this is fine too. I have someone with a stopwatch behind the camera too, so we're going to be timing you. Okay. All right, let's go ahead and sit back down. Okay, Damon, we're on the last item. So for this one, you're going to stand on one leg as long as you can without holding on. Okay? All right, go ahead and sit back down. So Damon, I have the results from your Berg balance scale right here. I've totaled up all of the items that you did and all of the scores that you had, and you scored a 20 out of 56. So then if we go to the table with all the different categories, there's 3 categories. There's independent, walking with assistance, and wheelchair bound. So you fall in the wheelchair bound category because you scored a 20. Wheelchair bound is 0 to 20. So you're right on the end of that. You're almost in the next up, which is walking with assistance. I know that you walk with a walker. I know that you prefer to walk. You wouldn't want to be in a wheelchair, right?
Right.
So basically what this means is that you are at a very higher risk of falling unless you are using a wheelchair.
Okay.
So I know that you don't want to use a wheelchair, and I know that you're really on that edge. So what we're going to do is we're going to talk about some strategies, some techniques that you can take home. Think about whenever you are walking around in your home. You don't really go out in the community using a walker, right? You just kind of, in your home, you use your walker. Okay. So some things I'm going to recommend is make sure that your house is clean. There's like no things on the floor that you could potentially trip on or something that could potentially cause you to fall. So be aware of your environment and your surroundings. Make sure that, there's just nothing that could potentially harm you or get you off balance, because that is the biggest thing, is your balance. So the purpose of me giving you this assessment is because I wanted to assess your balance and your stability doing activities, or just your overall balance in general. So I want to, once we start doing interventions, working on your core and your trunk stability and strengthening your muscles, I want to go back to this assessment when we reassess you and see kind of if we have improved, if we haven't improved. That's the purpose of why I chose this assessment, because like I said earlier, I know you've had falls recently, more often than not. So I know that you are a fall risk, and the results do prove that. So what I'm saying is, I knew that before we took this assessment and got the results, but I want to use this as your baseline starting, so that whenever we start to make progress, we can reassess and see like how many points you have progressed, if you have progressed, stuff like that. Does that make sense?
Yes.
Do you have any questions for me?
I do not.
Okay. Okay, Damon, now I'm going to have you fill out the FAMS assessment. You're going to read the question and then rate it at not at all, a little bit, somewhat, quite a bit, and very much. If you have any questions about any of these, just let me know. I'll be sitting right here, okay?
Okay. So I have a question about this one. I don't have a job right now, but I do cook my son breakfast every morning, so it's kind of like my job at home. Does that count?
Yes.
Oh, okay.
Yeah, you can count that.
Okay. think I'm done.
Okay. Do you have any questions about it?
No.
Okay. Okay, Damon, so these are the results from the FAMS assessment that you took, so that questionnaire that you did. So I have the results. I added up all of these items, and I have your total score, which is a 69 out of 176. So that's about 39% of how happy you perceive, or how you perceive your overall quality of life. So how happy you are in your life. So quality of life basically just refers to how you perceive your physical, emotional, mental, and social life.
Okay.
Your overall well-being. So the lowest item on here is mobility. You scored a 4 out of 28 possible, and then the others were around half of the max range. So mobility was your lowest score. So I'm going to take that into consideration when doing your plan of care, thinking about the things that we want to address so that we can bump up that score. And then hopefully towards the end of our sessions or midway, we can take this again and kind of assess how you perceive your quality of life and how well you enjoy your life. Does that make sense?
Yeah.
Okay, do you have any questions or concerns about this?
I don't think so.
Okay. Okay, Mr. Damon, so now we're going to talk about MET levels. Do you know what MET levels are? Have you heard of that before?
No, I haven't.
Okay. I'm going to go over them really quickly with you, and if you don't understand, just let me know, and I'll try to explain it as best as I can.
Okay.
So basically, what a MET level or a metabolic equivalent of a task is it's how much energy you're going to use during an activity compared to just sitting and resting. So every activity is assigned a MET level that's equivalent to it. So depending on your condition, how you're feeling for that day, your MET levels can vary. So it's not just you are assigned a MET level and that is your MET level for the rest of your life. It's just depending on your condition and how you're feeling that day. So I'm going to give you an example, and the MET level that I have assigned for you at this time because of your condition, and that's going to be regarding your lower body dressing. I know that you have a lot of trouble dressing your lower body. You mentioned your wife helps you the majority of the time putting your pants on, your socks, and your shoes. Is that difficult for you?
Yes.
Yes?
Yeah.
Okay. And you also said that your body feels really sore like a few days after doing that activity by yourself. Is that correct?
Yes.
Okay. So for that activity, according to the Compendium 2024 for adults, that dressing and undressing while sitting is 2.8 MET levels.
Okay.
Okay, so to give you more of like a range of MET levels, it's 1 MET level to just be laying down, breathing, not doing anything. That's 1 MET level, and it's going to be about 9 to 10 MET levels for running.
Okay.
So the more physical activity you're doing and the more energy you're expending, that's going to be the more MET levels that are required for that activity. Does that make sense?
Yes, that does.
Okay, so since stressing your lower body while sitting is the hardest activity for you at this time, your MET level is 2.8. So every activity that we do in our sessions, we're going to try to keep them around 2.8 or lower. We don't want to put you doing activities that are over that because we want to conserve your energy. We want to make sure that you can complete all the activities and you're able to tolerate activities. So that brings me into my next part of this. is I'm going to share with you some energy conservation recommendations as well as some activity tolerance recommendations regarding your MET levels. So I have this handout for you that we're going to go over, and it's some tips to conserve energy with the meal and home tasks. So I'm going to let you keep this. We're going to go over it, but there's different home tasks on this paper with different bullet points and recommendations for you to utilize while you're doing this activity. So first off is cooking. I know you like to cook breakfast for your sons every morning. So here are some real life examples of how you can pace yourself and rest while completing cooking.
Sure.
So maybe gathering all of your ingredients before starting. So maybe breaking up the activity of cooking into sections. So like what this is saying, gathering all of your items before starting, and then maybe sitting, taking a rest break, sitting down, taking some deep breaths, conserving your energy so that you're able to complete that cooking activity, so that you don't run out of energy.
Yeah.
And then another bullet point is maybe sitting to prepare and mix foods and wash dishes. So instead of standing to prepare and mix foods and standing to wash dishes, maybe sitting would be a good recommendation for you, and maybe that would be good for you to try to increase your activity tolerance.
Okay.
Do you know what I mean by activity tolerance?
How much I can take from doing.
Yeah, just making sure that you're able to tolerate that activity, that you can complete that activity. It's not too difficult for you.
Okay.
So by conserving your energy during these home tasks, or just by maybe transferring to the toilet to use the restroom, taking breaks in between to conserve your energy so you're able to tolerate that activity and complete it. Okay? So I'm going to let you keep this, take this home. There's cooking, meal cleanup, meal prep, shopping, meal planning, laundry, house cleaning, bed making. So all kinds of good techniques for you to use for home tasks. And I know that you were sharing with me you don't know what type of MS you have. Is that correct? You don't know?
Yeah.
Okay. So I've also made this handout for you over multiple sclerosis, which is what you have. I have different boxes explaining what it is, the signs and symptoms, what type you have specifically, the prognosis or what it looks like, and then different management techniques. So I'll briefly go over this with you, and then I'll let you take this home as well.
Okay.
So you've had MS for 4 years, so surely you know what it is and how it kind of affects your body. I just want you to have a better understanding, because sometimes when people have a condition and they don't fully understand their condition, it could be a safety hazard, and it could be unsafe for them. So it's good for me to educate your condition and make sure that you understand it, because I don't want you to be overconfident in something and to hurt yourself.
Okay.
And I know that you also fall often.
Yes.
You're a frequent faller. And so hopefully by educating you on falls and MS, we can reduce all of those incidents, okay? Okay. So MS, it's a disease that's going to affect your brain and nerves, and it's whenever your body is attacking your immune system. It's attacking the healthy parts of your brain, and it typically happens for people ages 20 to 40, which would make sense because you're 46 and you've had it for 4 years. So that is what it is. So the specific type that you have is relapsing and remitting. So that means that your symptoms are going to come and go, but you are going to continue having this condition. It's not going to go away. But you will have times of your life whenever it's better, your symptoms are better, and then times whenever you're having flare-ups and it makes it worse.
Okay.
And on here it also talks about how medicine can help reduce flare-ups whenever they happen. So that's basically what your condition is, and that's kind of how that the timeline of your condition will kind of go. Okay. And then some signs and symptoms, which you present with the majority of this, so this would be easy probably for you to understand. You have muscle weakness and stiffness. Those were one of your main concerns, was stiffness. Balance problems, dizziness, physical fatigue, tiredness, some cognitive changes, so it might be hard to remember things at times. So those are some common signs and symptoms with this disease, with this condition. And then the prognosis, like I said, there's no cure. So it's going to progress over time. And it depends on the type of MS, which is what I just talked about, your relapsing remitting. It's going to continue to come back, and then at times you'll feel fine.
Okay.
So with relapsing remitting, it could be weeks to years before an episode of symptoms could occur. So that's another thing to keep in mind. So you may be feeling great for weeks, and then, one day these symptoms may come. So don't think that just because you're going a streak without having any symptoms that you're cured from it and you can do anything that you want. So just be cognizant or be aware that it could come back, and that it will come back at some point. And that it can be managed. So we'll go over here to management. So symptoms can interfere with your daily activities. As you know, you fall frequently, you're unable to do some activities, you may need some help doing some of those activities. And there are some medications that can help with those symptoms. And then obviously there's physical and occupational therapy that can help, and that's what I'm here for, is to help you manage. And then a healthy diet and lifestyle. This can help decrease how those symptoms come and how hard they come back at you. If that makes sense.
Yeah.
And then gentle exercising can also be good to manage, and we're also going to be talking about that today, because I'm going to show you a home exercise program that I made for you, and I'm going to demonstrate it and show it to you as well.
Okay.
So now that I've gone over your condition, MS, do you have any questions about that?
No.
Okay. All right, and we went over METs, energy conservation. Do you have any questions about energy conservation or activity tolerance? I'll let you keep all of these.
I don't believe I do.
No? All right. Well, we're going to go ahead and get started with your home exercise program. Okay, Mr. Damon, so now what we're going to do is we're going to go over your home exercise program that I made for you. I'm going to explain why I chose this exercise program. First, I'm going to start by saying it's going to engage your core, and it's going to be working on your balance. So I found 2 studies that I researched. One of them is to prove that balance is good for rehab, or balance is good rehab for fall prevention. So a 44 subject randomized study was conducted to determine if balance training in patients with MS or multiple sclerosis is effective in reducing fall rates. And what the study found was that balance rehabilitation appeared to be a useful tool in reducing the fall rate and improving balance skills. So that's why we're going to be working on balance, because it's going to reduce that fall prevention, because I know you've been having frequent falls. And then this study talks about how core activation is a good balance intervention. Okay. So it ties into how balance is good for rehab, and this is talking about core activation.
Okay.
So this study was conducted for MS patients to determine how effective participation in balance exercise program that focused on core stability to improve participation in daily activities. So basically the results indicated that patients with MS that participated in this program, it helped them to engage and strengthen their core muscles, to then allow for increased participation in other occupations.
Okay.
Does that make sense?
Yes.
So basically, I've found evidence that supports how balance is good rehab for fall prevention, and then how core activation as an exercise is good as a balance intervention. So now for your exercise, I have chosen a home exercise program for you that meets all of your MET levels that we talked about earlier, as well as addresses your client factors. So those deficits and those concerns that you had, we're going to work on those with this home exercise program. So I've created this program and I've printed it out for you. You're going to get to take it home. We're going to go over it briefly, but I'll go ahead and tell you more in depth why I chose it for you so you can understand. So I chose this home exercise program to target your joint stiffness, your core and trunk instability, which could be part of the reason for your balance issues and your balance instability. Your decreased muscle strength and your range of motion that you talked about in your whole body and especially in the left side of your body. Your fatigue, that you're a fall risk, and your decreased activity tolerance and your decreased balance. So those are all the areas that I'm wanting to work on with you through this home exercise program.
Okay.
So before we go over the program, do you have any questions?
No.
No? Okay. So before I go over the program, I'm going to ask you some questions, some activity contraindications and precautions, just to be sure that none of these exercises that I have made for you contraindicate or make it to where you cannot participate in these activities. So I found a study that had made exercise prescriptions for MS patients, and in this study they asked the participants these precautionary questions to maybe accommodate them before they exercise and just to see if they have any of these precautions. So I'm going to ask you these questions. If you have them, just tell me yes. And then if you do have any of these precautions, we can address them as well.
Okay.
So fatigue, do you have fatigue?
No.
You don't have?
Oh, yes.
Okay,
Yeah.
yes. Spasticity?
Yes, in my left arm.
Okay. And heat intolerance?
Yes. No, I don't.
No heat intolerance?
No.
Okay. Do you have any cognitive deficits?
Yes.
Okay. Yeah, I was thinking, you told me you had some fatigue earlier, and you're telling me you don't know. Okay. So cognitive deficits, just a little bit, yes. Lack of coordination in extremities?
Yes.
Okay.
Yeah.
Sensory loss?
No.
Motor balance?
Yeah.
Daily variation in symptoms?
No.
And do you have any urinary incontinence? Do you have trouble keeping your bladder under control?
No, I don't.
No? Okay.
Yep.
So you said you have fatigue, spasticity, cognitive deficits, lack of control and coordination in the extremities, and some motor
Correct.
balance. So to address your fatigue, we're going to make sure that you take rest breaks when needed. Not just in today's session, but in sessions to follow. We'll make sure to accommodate that for you. And then for spasticity, since there are no free weights and you won't be grasping anything in this home exercise program, that's nothing that we have to worry about. And then for the cognitive part, I have included images of what the exercises look like, as well as explaining step by step how to get through the exercise. So if for some reason this isn't making sense, there's images that you can follow.
Okay.
And I will be giving you verbal cues today as needed.
Okay.
So I'll be verbalizing things for you to do if you are having trouble, okay?
Okay.
And for that lack of coordination and balance, we're going to be lying on a flat surface. We're going to be laying on a bed, so we don't have any safety hazards to be concerned about, okay?
Okay.
Because we will be laying down. So, do you have any questions?
I don't believe I do.
Okay, so now that we've gone over that and contraindications, you don't have any exacerbating symptoms today, where the activity could potentially make those symptoms worse. You're feeling pretty good today?
I feel really good.
Okay.
Yeah.
So we don't have any contraindications as well. So now what I'm going to do is I'm going to go over the home exercise program with you verbally.
Okay.
And then we're going to go to a bed, and I will present these to you as well. I'll go through all of them, and then I'm going to have you demonstrate them.
Okay.
Do you have any questions about that?
Nope.
Okay. So the first exercise we're going to do is the knee twist. So just like this image here, you're going to lay on your back. You're going to bend your knees, so your feet are going to come towards your bottom. You're going to lean both knees to one side and stop when the knee touches the bed. So you're going to bring both knees to one side and then move to the opposite side and touch knee to bed. And that is 1, 2.
Okay.
So every time you come back up, that's 1. So you're going to do that 10 times, 2 sets of 10. So you're gonna do this 10 times, and then we're gonna go on to the next one. I put 2 sets on the whole thing. You're gonna do 1 set of each, and then you're gonna do it again from the beginning. So that will be your 2 sets.
Okay.
So you don't do them back to back, 2 sets, unless you're just really feeling good and you want to get it done. But I would recommend that you do 1 exercise, the next, finish all of them, and then go back and start from the beginning to do that second set.
Okay.
So you're going to do 10 of those, and then we're going to go to leg extensions. So again, with your knees bent, you're going to lay on your back, bend both knees, straighten one leg, extend leg in the air, and then lower that leg to the bed and bend both knees. So you're just sitting there with your legs on the floor. You're going to extend and then bring it back down, and then alternate with the other leg. So you're going to do that 8 times for each leg. So I said each side. So make sure you do 8 for your right leg, 8 for your left leg.
Okay.
Then we're going to go to the next exercise. Do you have any questions about the first 2?
Nope.
Okay. So for the next exercise, this is alternating knee and arm raises. So you're going to be laying on your back on the bed. So you're going to lay on your back, bend both of your knees, extend one leg. So you're going to keep your heel on the bed, just like this picture shows. So you're going to extend one leg, and while you're extending that leg, you're going to raise the opposite arm over your head.
Okay.
And I put a note, it's not shown in the picture. It doesn't show them bringing their arm over their head, but you're going to raise the opposite arm, and I will verbalize that as well whenever we're doing it. And then to the next one, we're going to do bridges. And this is going to help with your core and also with bed mobility. This is important for like scooting in bed and stuff like that. So we're going to do some bridges. As you can see in the picture, they're laying on their back. Their knees are both bent. They're going to raise their bottom off of the bed like this picture. And then they're going to lower their bottom back down to the bed, and that's 1. So you're going to do 8 of those. And then after you finish this one, you're going to go back to the top. So only 4 exercises, and then it's 8 because you're doing them twice. Okay. And I didn't mention in this one, the alternating knee and arm raise, you're doing them 8 times for each leg. Okay. So you'll extend your leg, raise your arm, and that's 1 for that side. So you're going to do it alternating, like right leg, left arm, right arm. That's 1 for both. Okay. So you're going to do it 8 times. And again, you're going to do all this twice. Do you have any questions about this?
Nope.
Okay. And as you can see right here, I have that this exercise is 2.8 METs or less. It's probably a little bit less than 2.8, but it went under the calisthenics box in the Compendulum 2024 for adults.
Okay.
So the calisthenics is basically body weight, this is body weight. You don't have any weights. So, and it is a core strengthening exercise. So that's just what this is on this page, 2.8 METs. And to remind you, your max METs at this time is 2.8.
Okay.
Okay, so I'm demonstrating the first exercise, which is the knee twist. So this is where you're laying on your back, you bend both of your knees, and then you're gonna take your knee and put it to one direction, and then to the other.
Okay.
That's 2, 3, 4, 5, 6, 7, 8, 9. You do this 10 times.
Okay.
So you're gonna do that 10 times, and then next is the leg extension. So you're laying on your back, both knees bent. You're gonna extend one leg, raise it up in the air, bring it back down, and then back to bend. Okay. And then you're gonna do that with the other leg. Extend, raise, lower, bend. Okay. That's 1 for both.
Okay.
You're gonna do this 8 times for each leg. Okay. So I'll do it again. Extend, lift, down, bend, extend, lift, down, bend.
Okay.
And if you get lost, I'll verbalize these to you just like how I did that. Extend, lift, down, bend. Okay?
Okay.
So you'll do that 8 times on each leg. And then next we have alternating knee arm raise. So that's where we're going to start with our knees bent, and we're going to extend one leg while we're raising our other arm over our head.
Okay.
And down, up, and down, keeping our heel just sliding it on the bed.
Okay.
Up and down. And like I said, the image is not showing the arms going over the head, but it is listed on here in the list of things to do. It's
Okay.
listed on here.
And how many times do I do that?
You do this 8 times.
On each side?
8 times for each leg, yes.
Okay.
And then the bridge. So this is going to be with your legs bent, laying on your back, and you can put your palms down like this to kind of help you with that stability of balance.
Okay.
And what you're going to do, you might need to bring your feet a little bit closer if you need to. You're just going to lift up your bottom
Okay.
and then set it back down.
All
And
right.
that's 1.
Okay.
So you're going to lift your bottom, squeeze, and lay it back down. Okay? So you're
Okay.
going to really have to activate your core on this one.
Okay.
And we're doing this one 8 times,
Okay.
2 sets. So everything that I just did, you're going to do that all again.
Okay.
So 2 sets. Do you have any questions before you demonstrate this to me?
Nope.
Okay. All right, Mr. Damon, I have your exercise right here. Are you ready to get started?
Yes.
Okay, great. So we're already laying on our back. How are you feeling?
Feel good.
Okay, you feel ready to do this exercise?
Oh yeah.
Okay. So first what we're going to do is we're going to do the knee twist. So I'm going to have you bend both of your knees. Yes. And then I want you to lean them both to one side and touch them to the bed and then to the other side. That's 1. That's 2. Ups. And then keep going. 3. Up. 4. Can you count out loud? Up. 5.
6, 7,
10
8,
times.
9, 10.
Okay. For the next exercise, we're doing leg extensions. So laying on back, your knees are bent. I want you to straighten one leg, extend it in the air, and then lower it to the ground, okay?
Okay.
You're going to do this 8 times. Extend, up, down, bend. That's 1 for your right leg. 1,
2, 2, 3, 3, 4, 4, 5, 5,
I want you to feel your core engaging in your hands right there, okay?
6, 6, 7, 7,
You don't have to kick your leg up that high. Just a little bit is fine.
8,
Yeah.
8.
Awesome. Now we're gonna do. We can take a break. Let's take a break since we're halfway done with the first
Okay.
set. So let's take a couple breaths, okay? Just breathe out. Good. Breathe in. Okay, take another deep breath in. All right, you can extend your legs just to give them a little break. Being bent. Okay. Another deep breath in. One more. All right, are you ready for the next 2?
Yep.
Okay, so this is the alternating knee arm raises. So I want you to lay on your back just like this, and I want you to bend your knees. I'm going to have you extend one leg while you're raising the opposite arm over your head. We're going to do this 8 times.
All right.
Whenever you're ready. Keeping those heels on the bed. And count for me.
1, 1,
If you
2,
need to bend your elbow over your head, you can.
2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 8.
Good. How are you feeling?
Feel like I have a 6-pack.
Do we need to take a little break, or
I'm good.
you ready to keep rolling?
Ready.
Okay, so this is our last one. Your hands, you can keep them there for some stability. We're going to keep our legs bent, and this is our bridge. So we're simply going to lift our bottom off of the bed and then lower it.
Okay.
We're going to do this 8 times.
All right.
Whenever you're ready. Count out loud for me.
1,
Heard your hip pop.
2, 3, 4, 5, 6, 7, 8, 9.
Just 8. 8's good. Yeah.
Okay.
And if you need, you might want to spread your legs apart a little bit.
Okay.
To give you a little bit more stability.
Okay.
Okay. So we'll try that next time.
Okay.
Okay, so let's straighten our legs and take a few more breaths to get ready for this next set.
Okay, I'm ready.
You ready?
Yeah.
Okay, so we're doing the knee twists. I want you to be able to tell me what it is, okay? So you're demonstrating that you know what these exercises are. And you can look at this paper. I'm not here, now you're at home, so you don't have me. So I want you to demonstrate that you know based on these images and how it's written that you know what to do, okay?
Okay. Knee twist. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay. Good.
Leg extensions. Okay. 2 sets. 1, 2, 3, 4, 5, 6, 7, 8.
If you feel at any time you need to
9,
take a break, you can, okay?
10, 11, 12, 13, 14, 15, 16.
Good. You take a break?
Good.
Okay.
One, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8. 8.
Good.
Bridge. 8.
You can start with your legs apart, and if that's too hard for you, you can put them back together like you had it the first time.
Okay. 1, 2, 3, 4, 5,
is. What is something that you're activating that we're working on in these exercises?
Core.
Which is good for?
Stability.
And?
Balance.
Good. Did you feel it anywhere else other than your core?
Yes.
Where?
My legs.
Good. Because we want to strengthen our legs too.
Absolutely.
So that we can walk, because we have a walker.
Yep.
All right. Good job. Do you have any questions?
I don't think I do.
All right. Makes sense.
Makes perfect sense.
All right. Awesome. Okay, Mr. Damon, do you have any final questions or concerns about the home exercise program that I made?
Nope.
No? So you feel good about it?
Oh yeah.
Feel like you can take it home and you know exactly what to do?
Mm-hmm.
Okay. Well, if you have any concerns about it or anything that you're having trouble with, bring it back to me. Let me know your concerns and we can tailor that to you.
Okay.
All right. So you have that to take with you. And I'm going to give you this other handout that addresses some exercise tips for MS.
Okay.
So it's going to talk about activity tolerance and that energy conservation that we talked about earlier today. So it has your name, today's date, my name, and my number on the top.
Okay.
And then I do the checked exercises 1 time a day, 7 days a week.
Okay.
That's what I recommend. If that doesn't happen for some reason, if your symptoms are really bad that day and you feel like you can't do it, then and you feel like your symptoms may worsen because of exercising, then let me know, tell me, and don't worry about that. But I recommend 7 days a week if you're feeling up to that. And then it has some pointers like exercise slowly and smoothly, avoid getting tired, stop and rest often as you need to. So this is going to be to help conserve energy so that you don't get too fatigued and tired and you aren't able to complete all of the exercises, okay?
Okay.
Use good posture. We want you to use good posture. Make sure that you are activating what you're supposed to. We don't want you to hurt yourself or do something you're not supposed to. So make sure you have that good posture, which should be pretty simple since you are laying down. Keep your stomach muscles tight and your back straight. Like I said, we want to activate that core to help with the balance. Do not hold your breath during the exercises and count out loud if needed, like we did earlier. I had you count out loud.
Okay.
Make sure to not hold your breath though. We want to keep breathing so that we don't get more fatigue because we're holding our breath or pass out or something else happen like that. Avoid increasing your core body temperature. So don't exercise during the hot time of the day. Make sure that we get plenty of water and cool fluids. And if you notice any symptoms that you didn't have before you begin exercising, slow down. Stop exercising until you cool down also. So if your body temperature starts to get really hot and you start to feel really bad, stop exercising, cool down, drink some water, and you can continue if you start to feel better. But utilizing those techniques that I taught you, you should be conserving your energy well.
Okay.
But if that does happen, just remember to stop, take a break until those symptoms go away, okay?
Okay.
And sore muscles last a few days, and feeling tired are normal after exercise. Exhalation, sore joints, and painful muscle pulls are not normal.
Yep.
So,
Exhaustion.
sorry, I don't know what I read. Exhaustion, sore joints, and painful muscle pulls are not normal.
Okay.
So if anything like that happens, let me know, and we will figure it out, and I will retailer your program.
Okay.
And then, like I said, if you have those symptoms, don't exercise until you talk with me.
Okay.
And if you have chest tightness or pain, shortness of breath, feel dizzy, faint, or sick to your stomach, stop and call emergency services at 911.
Okay.
Okay, and that's all that I have. So these are all of the exercise tips you have. Do you have any questions about this?
Nope.
Okay. So, can you tell me what your treatment was about today? What did we focus on? What was our goal?
To strengthen my core and trunk for mobility and balance.
Good.
Yep.
All right. And I do want to address that since you are a fall risk, I tailored today's exercise program to your specific needs. That is why we were laying down in bed. I didn't want to bring up any safety hazards that you might experience, especially while I'm not here, since this is a home exercise program and you're going to be doing this on your own. I wanted to make sure that there were no fall risks involved and that you can do it while laying in bed. And I also want to bring up why I addressed your condition with you and why I educated you on that. It's because that is also a safety concern and a safety hazard. And so through educating you on that, that's going to decrease any knowledge that you don't have about it. And now you understand what your condition is, you understand what your limitations are, so that you don't exceed your limitations and potentially harm yourself. So since that was also a safety risk, that's why I included education on your specific type of MS. Does that make sense?
Yes. Yeah.
And you have that handout as well if you need to reference back to that. Do you have any other questions about today's session at all?
I don't. No.
All right. Well, thank you.
Thank you.
Have a good day.
You too.